Hey, I hope Brendan here, registered nurse from the United States, living and working in Sweden as a nurse. I am doing a follow-up video to one of my viral videos. It was a video that I got the most views I've ever had. A couple months ago, I got over 125,000 views on it as of today, and I got upwards of about 480 subscribers and 98.5% likes. So I felt like that was good enough reason for me to do a follow-up video, kind of let you know how things are going. So if you have any questions, this video is a follow-up to my tooth extraction I got done here in Sweden that went bad, and I ended up having complications and got admitted to the hospital. So this is a follow-up video to that. If you have any questions, please watch that video if you haven't already. It's kind of a long video, and it should cover a lot of the questions that you probably have. And so I don't want to cover everything in this video, otherwise it's going to be way too long. So first of all, I want to say thank you to everyone that was so supportive and kind. Like I said, I had 98.5% likes on that video and a lot of wonderful support and kind comments, a lot of helpful information and advice as well. And so a little follow-up. So I am better. I'm healthy now. So in the short, I had a tooth removed around, it was on a Thursday, somewhere around October the 10th. And it led to a couple days later on the weekend when the dental office was closed. I had a lot of pain and I ended up with a tooth infection, and it led to me eventually having to be admitted to the hospital and being on antibiotics, and then I got taken off the antibiotics, and then the infection came back, so then I got put back on them, and I ended up being on antibiotics for a total of 6 weeks. And that was no fun. So I'm no longer on antibiotics, and now we're at the stage where they've given me the green light to discontinue my follow-ups at the jaw surgeon, and now we got to talk about pulling the other tooth. So I'm pretty scared because I had such a bad situation with this tooth, and this other one, the left one, is actually the more serious one because the cyst is smaller, but the tooth is lying on a nerve. It's an impacted tooth covered with bone and gum that will have to be removed. So that is where we're at now with that. Just kind of wanted to address too some of the things that got brought up in the video. So the 1.5% dislikes and negative comments, they had to do with several different things. So one of them was, you should have done this and you should have done that. So one of them was, you should have called the ambulance when you were feeling bad. Another one had to do with, it was interesting to see there was a clear delineation from comments from people that live in Scandinavia and northwesternish Europe, and then the rest of the world. When it came to prescription for antibiotics and prescription for pain medications. Then I had some comments about America's the greatest healthcare system in the world, and Europe is the greatest healthcare system in the world. I kind of want to talk a little bit about some of those things. So first off, I want to say, when I did the video, I was sick. And when you're sick, you don't feel good. I'm not a professional YouTuber. This is a hobby. It's something I enjoy doing. I enjoy creating content, but I have a full-time job I work at. So this is not like my videos are, highly edited and polished and everything. This is just me being my authentic self, except for the fact that I do have autism, and so that makes communication very difficult. So sometimes if my tics gets really bad, I have to edit that out of the video. Otherwise, it'll be distracting. So, like I said, I'm not a professional YouTuber by any accounts. And so one thing I've noticed with people is they get hung up on one word or one sentence you say, and instead of looking at the whole big picture of what a person's trying to say, and this isn't just on YouTube videos, this is just people in general. I feel people, they get lost in the words and the semantics, and they miss the whole point of what a person's trying to convey. When you talk, there's what you're trying to say, what's being said, and what is being heard. And that's always the way it's been. And I think communication is an art form, and that's something definitely I can be better at. But it's also the listener. Listening is an art form as well. And being able to watch a video and be like, okay, this guy, he said this, but he probably means this. That is an art form. On top of that, I was very sick. I had an infection. I was on 6 weeks of antibiotics, not sleeping well, not eating well. And so, I'm not a movie star. I'm no one special. So I may say things that it's like, well, why did you say that? And people get hung up on that word. So one of the things was I was just trying to think out of the box. Like, how could this have been a better situation? I ended up really sick. It could have been a life-threatening situation. There have been people that have died from these kinds of things. And I couldn't understand, like I said, I'm a nurse. I'm a prescriber from the United States, but I'm not a dentist. So I don't know anything about that. And then things are different in America versus Sweden when it comes to dental care. I've never had a tooth pulled. There were just so many unknowns. And then I'm using my experience of 16 years as a nurse to kind of help guide me. Plus, I had a lot of input from wonderful friends that are doctors, nurses, and dentists here in Sweden and in America and other countries. They were giving me feedback, trying to guide me. And so, you're kind of putting that all together. And then on top of that, you're sick. You don't feel good. You're in a country that you're unfamiliar with the healthcare system. And so I was kind of thinking out loud a bit about how this situation could have been avoided. And part of what I mentioned was because, like, I don't work in dental care. I don't know how that works. And my question was, couldn't a person prescribe, because my dentist was closed on the weekend, couldn't they prescribe in English you say a PRN medication for like pain medicine or antibiotics? And I was just trying to think like out of the box, because I'm one of those people, if you have a problem, come with a solution. Don't just complain. Don't just rant about things. You need to have a solution. But it seemed like the 1.5% of people that didn't like the video and kind of got on my case was mostly about that. And so I just want to say I'm not advocating to willy-nilly prescribe medications. What I'm advocating for, and all the literature out there says this, it advocates for good stewardship of prescribing pain medicine and antibiotics. One thing people were standing up for, the way things are done here in Europe, is, well, there's the fear of addiction to pain medication. But I see that the pendulum has probably swung a little bit too much the other way. As a nurse who's worked both in the United States and in Sweden, I can proudly say that in my department where I work, this is not a problem. Pain medicine is well managed, and so is infections, antibiotic prescriptions. However, I have seen patients that come to us from other areas, other departments in Sweden, who they go too long without treatment, and it leads to a lot of complications, whether it be pain medicine or antibiotic treatment. Withholding a pain medicine can be inhumane, and it can also lead to many other complications. And you're not preventing an addiction by not prescribing a medication, because a lot of people, they can get treatment off the street or go across the country to Denmark and go get something. I've heard of such cases. On top of that, you're talking about decreasing quality of life. If the person's not able to eat, they're not able to sleep, they can't function, they're laying on the sofa for weeks on end because they're in so much pain. What is that? That's inhumane. So I don't advocate at all for giving out pain medicine willy-nilly, but I do advocate for good stewardship of pain medication based on evidence and science. And there's lots of information out there to help doctors and dentists to know when to prescribe a medication. Also, I do think that there is a level of responsibility that lies on the patient. We can't treat patients like children, and there are exceptions to that. There are people with certain diagnoses, and that's where being a good steward would help you. As you're looking through the patient chart, you find out, or talking with them, you find out, okay, this person has a history of addiction, so maybe they're not a candidate for this certain pain medicine. We got to do something else. So a fear of addiction should not be the sole thing that a person is looking at when it comes to treating pain medicine. I was on the maximum dose of the typical, Tylenol, or they call it Alvedone hair, maxed out. I was maxed out on ibuprofen for days. I would go get treatments at the dental office when they would have to pull out the pus and everything. And as a lot of people said in the comments, taking out all that pus and everything, the injections, the anesthesia doesn't work because, it's mixing with the pus, and so you're not going to get a good effect from the anesthesia. Whereas I heard a lot of people say in the comments, if that would have been done in America or other places, then they would have given me medicine another route, some other kind of medicine, so that I wouldn't have been put through so much pain. it's bad when you're in that much pain in a chair and they're standing around and they're scared that you're going to pass out. And so they're having to put your chair in reverse Trendelenburg to get the blood flowing back to your head. I experienced that a couple times. They had to keep stopping, and I never told them to stop, but they would see the signs and symptoms that I was in a lot of pain, and I couldn't breathe. I was like holding my breath because I was in so much pain. And people shouldn't go through that. When it comes to the antibiotic stuff, people are like, oh, it's wonderful, antibiotics, we want to prevent antibiotic resistance and all this kind of thing. We need to save the antibiotics for other people. But now you create a new problem. When the pendulum swings too much one way and you're too strict, now I ended up on antibiotics for 6 months and I was on 2 antibiotics. Plus, you think about all the damage that was done to my jawbone because of the bone infection. So it's like, yeah, you're advocating for don't give antibiotics in all these cases, but I had a fluid-filled cyst. Could it have been infected and we just didn't know? It could have been infected. How could we resolve this? I don't know. I'm not a dentist. I'm just, talking about my situation. I'm trying to think out of the box. How could this have been better? And I think in my conversations with all these experts and surgeons, what it's come down to is the person that removed the tooth should not have removed my tooth, despite the fact that he was referred, highly referred, good referrals. He was not qualified, and he went above and beyond his league. That he wasn't an actual jaw surgeon, that it should have, even though he pulled teeth all day, that's all he does, and he trains other people to do that. I should have had an actual jaw surgeon do it. That's what I've been told by the jaw surgeons and my orthodontist, because I have braces as well. I've heard things said that too much bone was probably removed by him, and then that could have triggered the whole inflammation process. There's just a lot of unknowns, a lot of stuff we don't know. Any case, I'm alive. I didn't die. I'm scared to death about the other tooth, but they said from now on, any of those kinds of things, I'm going to get antibiotics. I'm going to get pain medicine from the beginning. Another thing that was brought up is it could be stress. I am a new person in a new country. My father died unexpectedly this summer, trying to learn a language, trying to get my nursing license in a foreign country, moving to a new town, getting an apartment. I had a foot injury. All that is stress, and stress lowers your immune system defenses. And so could it be that I was just so stressed that it affected my immune system? Could be. Who knows? But should that be a question possibly a dentist ask? It could be a guiding factor in if they're going to prescribe an antibiotic. Maybe they need to ask patients, are you going through a lot of stress? And like what? So then maybe a patient that's going through that could, I don't know. Like I said, I'm just thinking out of the box, trying to think how this could have been prevented. In any case, I'm grateful to all the care that I got. I'm very, if you watch my other videos, you'll see that I had a really good experience in the hospital, being taken care of, and I've learned a lot through this whole ordeal. The system is very different from America, and people are like, you should have done this, you could have done this, and the truth is, yeah, probably, but when you're that sick and you're a new person in a new country and you don't know how everything works, yeah, it's really hard, and it's easy to say you should have, would have, could have, but hindsight is 20/20, and no case is the same. Every patient is different, and I think what it comes down to is I think we just need to be more understanding and sympathetic to people when they're feeling bad and they're sick. We don't need to victim shame people, and that's kind of how I felt with some of those comments. Was there was a lot of victim shaming and a lot of condescension. But overall, I mean, like I said, 98.5% likes. I should be grateful for that, right? A lot of real good support. So that's kind of the update. I'm here, doing better, feeling better, working on trying to get my probiotics going in me and get my good bacterial balanced in my body again after being on antibiotics for 6 weeks. I still have some weird residual issues with this jaw. Like it feels really weird, and it's kind of hard to brush my teeth now because I have some like malformations in my mouth, the way it healed. But I'll be getting a follow-up with the dentist pretty soon, so we'll take a look at that. But anyways, yeah. So thank you so much for your support. Please make sure to like and subscribe. That really helps me out a whole lot with YouTube, as I don't get a whole lot of money from these videos or anything. It takes a lot of time and energy to put these together. And so, yeah, thank you once again, and have an awesome rest of your day.